You're certified in EMDR.
Right. Well, I'm trained in it.
Trained in it.
Yes.
Trained in
Yeah.
it. Yeah. And for those who may not know, EMDR stands for it's the
Eye movement desensitization reprocessing.
Yes. I'm glad you shared it because I would have butchered it. Yeah. And so you've been doing that, you said, for about 4-ish years.
Mm-hmm.
Yeah.
Yes.
Do you have a lot of clients who seek you out specifically for EMDR that you offer?
I have some. I think a lot of people don't necessarily know what that is. So certainly if I do have clients that are aware of what EMDR is and or they've had it before and they're just needing a different therapist at a different point in their life and they are seeking that out.
Yeah.
And then a lot of clients who maybe have some trauma history aren't aware of that modality. So I do a lot of talking about what that is and then we'll end up utilizing that.
Yeah. So I'll just pretend and ask you as though like I've never heard of.
Yeah.
So any type of trauma EMDR would work for, like emotional trauma, physical, you know.
Absolutely. Yeah. And I even use it sometimes where maybe a person doesn't have like a specific trauma incident that we're targeting, but they have maybe a lot of anxiety. Like they'll have like real negative core beliefs about themselves. And so we'll figure out, okay, what is this core belief that you have about yourself? Let's just say I'm worthless. Okay. What are some memories that you have that's attached to this belief that are still really upsetting when you think about it? And so we can use EMDR to process those memories and kind of reconsolidate that and turn down the emotional volume on those memories and experiences. And start to reprogram that core belief into something that's more positive.
Yeah. Yeah. And because I know this is my limited understanding, I participated in a training once of like I was sitting in the back of the room just to see if I was interested, and I liked it. I don't know why I didn't go in those directions. I do other things, but you come in for EMDR and you have to do the best word I have for it, not knowing the actual terms, like the first sessions with that is like you ground. You do all the grounding. Is that also the phase where you would start to identify those like core beliefs and things of that nature, or is that going to come in later phases of EMDR?
You know, I think it kind of depends. If, let's say, a person's coming in and they know they want to do EMDR to work on a specific trauma, then, you know, we've already kind of had a conversation about what that traumatic event might be. And so the initial phase really is doing more of that resource development and making sure, like, I'm teaching them resourcing skills. And there's a couple specific ones that I give actually most of my clients, whether we do EMDR or not. And I'm wanting them to practice that in between our sessions so that they know that if we ever need that in an EMDR session, you know it's going to work. And so that's kind of like the first phase. And then that's when we kind of go in and do what's called a target sequence plan. And we're just kind of mapping out like this trauma happened, but what is this trauma that happened to you? What does that mean about you? And usually that's kind of helping the client get at this belief that they have about themselves in relation to that experience. And then that's when we kind of just map out all the memories that we're going to target.
Yeah. Yeah. And so you're really, which every clinician I've ever talked to or known who does EMDR, they're, you know, it sounds like as I'm listening to you, like those sessions in the beginning are really like we're mapping out this foundation for you.
Right.
And my understanding too of EMDR and just any trauma work in general, but especially EMDR, is like we're not going into any of the rapid eye movement stuff until this is fleshed out.
Absolutely.
Yeah.
Absolutely. And, you know, sometimes I've had clients that they really want to work on their trauma, but they're just maybe not ready for that yet because their body still gets too dysregulated. And so we actually do a lot of work on helping them learn how to regulate their nervous system so that when we do the EMDR and they are having to kind of target that memory again and maybe other stuff that pops up along the way during the processing, their nervous system can be a bit more regulated, like they're not getting flooded in the session, because the first thing I want to do is make sure my clients are safe.
Yeah.
And if they're getting dysregulated, they're getting flooded in a session, that does not feel safe.